Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to the Gastro Girl episode today. We are here again with the lovely Dr. Pooja Singhal, who's a gastroenterologist and the director of the Women's Digestive Health Center at the SSM Health St. Anthony Hospital. Welcome, Dr. Singhal. Great to have you here again.
Thank you so much.
You're so welcome. So today we're going to talk about a topic that we've been getting lots of inquiries about. You know, some days I feel like I need to know what the answer is too. Why am I having trouble swallowing either food or liquids? Like, what's going on?
That is such a good topic, Jackie. And I'm so glad that you're doing this on this topic. In fact, on a personal note, in last 4 to 5 months, I have seen a lot of food impactions come through in the ER, and we'll discuss that a little later, what food impactions exactly are. I want to address your main question, the trouble swallowing. So let's talk about that a little bit. What does that look like? You know, when we talk about trouble swallowing, as a provider, as a physician, we want to know if you're having trouble swallowing solid foods or liquids, or are you feeling the sensation of something being stuck in the back of your throat constantly? The other thing we really like to know about is how long it has been going on till, because that really helps us figure out how to approach that. So, for example, has this been something that's been ongoing since childhood, or this has just been a couple of weeks symptoms after you started a new medication? Or is this something that is going on in somebody who has been smoking for a long time? So many different things can cause difficulty swallowing, and that's what's referred to as dysphagia. And it's very, very important to seek treatment and evaluation for difficulty swallowing, because we don't want to end up in the ER with a food bolus stuck in the esophagus.
Oh my God, that's so scary. Now, just to kind of set the tone here, we've been doing several episodes about EOE, which is eosinophilic esophagitis, which is an immune system, like a reaction, an allergic esophagus type of thing. We've done plenty of episodes about this, but this dysphagia, right? Dysphagia is one symptom. So just because you're having trouble swallowing doesn't mean you have EOE, but it is a symptom that you want to bring to the attention of your doctor so that you can get diagnosed with, you know, is there something else going on with my esophagus, or do I have, in fact, something called EOE? So this is what we want to focus on, this one symptom here. So this is really a good, important topic.
Absolutely. Absolutely. I mean, you said it. Dysphagia is a symptom, and that literally means trouble swallowing. And eosinophilic esophagitis is one of the more common evolving diseases that is very important to recognize that can lead to dysphagia. But dysphagia or trouble swallowing can be caused by inflammation and uncontrolled acid reflux. It can be caused because there is a stricture, which just means that there's a lot of scar tissue in the esophagus causing narrowing. And that scar tissue can be caused, again, by uncontrolled acid reflux or eosinophilic esophagitis, or it can be caused by malignancy. And the other category is if you're having trouble swallowing liquids, you could be having spasms and trouble with the motility of the esophagus. So many different approaches in management. But like you mentioned about eosinophilic esophagitis, it is very important to recognize that being a very important disease, because it's becoming more and more prevalent and it has continued to increase in its prevalence over last decade. And the good thing about eosinophilic esophagitis is it's preventable and treatable. So if it's diagnosed early, we now have very, very good medications on the market in our toolkit that really can lead to complete remission. And if it's not treated adequately, it can lead to long-term damage in the esophagus, and we don't want that. So that's
what you mean by damage. This is really, we did a great webinar about this, and there's a photo of a gentleman's esophagus that got so small a pea, and this is in one of the webinars we have online, a pea got stuck in his esophagus. Now, we're not trying to freak everyone out here, but we do want to highlight what can happen if it's left untreated, like you said.
Absolutely. And, I will give you in 11 years of my practice, I had never seen or heard, I just had this case of a patient who came into the ER, and I got called around 11 p.m. And literally the ER physician was like, the patient took 200 milligram pill, one pill of ibuprofen. That's it. And that is stuck. And I couldn't believe it, because I was like, oh, is there a history of eosinophilic esophagitis? Is there a history of stricture? And they were like, no, it was a young male. And I go into scope, and I did not think I was going to find a pill. And sure enough, it was so narrow that there was a pill sitting right there. And it was an ibuprofen pill. So you can imagine, like, this thin of a pill.
Oh my God. Well, this leads us to our next question. We can say we have trouble swallowing, but we're not going to always say to someone else, like, we could just, we start doing things, right? Start chug-a-lugging the water, maybe eating something soft to kind of push something else down. What are some of the adaptive behaviors that a loved one could be aware of, or a potential patient could be aware that they're doing, that would be cause to talk to their doctor about?
Great question. It's actually a mnemonic that we think of when it comes to adaptive behaviors that can mask dysphagia or mask even EOE or long-term stricture, esophageal stricture. And that mnemonic is impact. So I is basically imbibing a lot of food.
Okay, the brilliant Dr. Singhal, for all those who may not realize what mnemonic is, can you just briefly explain what that term is?
Yeah, it's just a memory device. So to remember what each letter stands for. So impact, I of impact, M for impact would stand for modify, and we'll go through each letter.
Right. So everybody got that? Each letter stands for something, and she's going to break it down so we remember what each letter means. Thank you.
Yes. So I for imbibe, meaning if you have a loved one or you yourself find always needing to drink liquids to wash food down, always, like almost a dependency, that's a little cause for concern. It's always good to drink a lot of water with your meals, don't get me wrong, but having almost a dependency to need to wash down food with fluid because you don't feel like it's made it all the way down to your stomach is a sign that there may be some scar tissue, that there may be some slowing, there may be some motility issue in the esophagus.
So for those listening, if you're at dinner with somebody, a loved one, or even yourself, and you don't realize that you take a bite and then you're like, gulp, 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 gulp.
Yes.
So that's something to be aware of. That's not normal behavior. It could be something wrong.
Exactly. Absolutely. And so the next one is M. M stands for modifying food. You find yourself cutting the food into small pieces before swallowing, or pureeing your foods. Oftentimes we see that a lot in elderly patients. They do that before you chew it, or your loved one chews it. That's also a sign to get further evaluation. P stands for prolonging meals. So, if you're out with a friend and you're finished within like 15, 20 minutes with a meal, and you guys are just chilling, and your friend is like not done even after an hour or two, it's a prolonged meal, and that it shouldn't be taking more than average time to finish a meal. That means that people are needing to chew, regurgitate, swallow again, chew again, and that's also a sign to get further evaluation.
Oh, that's a good one, because sometimes we may think they're just chatting away when in actuality they're adapting their behaviors because they're afraid they're going to choke.
Exactly. And my patient with the ibuprofen pill, his girlfriend told me that he was doing that. Like they would be sitting for 2 hours for a meal, because I questioned them, how can this be possible that they didn't seek help earlier? So coming back to impact, IMPA. A stands for avoiding harder texture foods. So you'll see people not wanting to order steak or, just really
Well, like
gravitate.
broccoli's hard, like
Yeah,
vegetables.
that's a good one. Absolutely.
Ah,
And coming to eosinophilic esophagitis, because that can also happen in younger patients, pediatric population, that's another sign because children don't present with the same signs. So if you see children or young adults really staying away from harder textured foods, certain group of foods, you may wonder what actually is going on.
and that's a good one because we often assume our child or a young person is just being picky, but there
Yeah.
could be a very serious reason why that child is avoiding certain textures of food or doing some of the behaviors that you identify. So parents or loved ones of children, be aware that this could be one of those signs that you might want to talk to your doctor further about what could be going on other than just being a picky eater.
Absolutely. Absolutely. And the impact stands for chew excessively. So people just kind of chewing over and over and over again for prolonged time. And the last one, T, stands for turning away pills and tablets. And that you'll see in more younger patients with EOE or elderly patients with different other etiology also.
Now, why, you don't think that someone would have difficulty swallowing like water or liquids. What causes that? And why would someone not be able to swallow something like water?
Yeah, that's a great question. So, the liquid. So, if you think of the esophagus as an accordion, but it's a vertical accordion, when we initiate a swallow, it's also synchronized. So, this layer has to squeeze, then this layer, then this layer. It's all very synchronized. And when you have the motility being asynchronized, not being working together, then you could have them going all separate time when you initiate a swallow. So something as benign as any kind of liquid will just kind of hold because they're not, this part is squeezing and this part is squeezing at the same time instead of this squeezing, opening, then squeezing, opening. So that's where your motility disorders come from. That's where we want to make sure you're not having significant esophageal spasms and things like aplasia. So that definitely needs further evaluation.
Yeah, I want to stay on this for a minute because there was someone who commented on one of our EOE videos. They said that they have difficulty swallowing water. So what would your advice generally, we can't give medical advice to a specific case, but generally if someone is having a hard time, is it EOE? Is it both? Could they have something else that's preventing them from swallowing naturally? And what would be the course of action for that type of a patient?
Yeah, that's a great question. So if there's any time there's trouble with swallowing liquids, you gotta get evaluation. Do not wait, number one. The first thing probably people would do, any provider would do, is get an esophagram where you just drink some contrast and they take pictures to see how liquid is going down. Right. And a lot of times in that imaging, you can pick up any kind of closing of the esophagus where it's called aplasia. Like you can see that very clearly. It's a type of motility disorder. If it's severe eosinophilic esophagitis where you can't tolerate liquids, you can also see that on esophagram, and you can see spasms as well. So esophagram and then EGD. EGD is when we take the camera when you're asleep and go down and directly visualize your esophagus, which is the food pipe. Those are the two testing you got to do right away.
Oh, this is great advice. I can't wait for this episode to be live so we can, share this video with some of the people that have been commenting and looking for more information. So thank you. Wow. So what else should people be aware of when it comes to behaviors that are adaptive? It is getting to the summer time. We're at the beginning of summer where barbecues are starting and people are probably eating lots of hamburgers, hot dogs, steaks, chicken, pork, barbecues, things that could get stuck in their throat. So this is probably a good time to raise awareness. What's normal? What's not normal?
Absolutely. I think the biggest advice I would give is if you have any of these symptoms, if you have noticed that you have prolonged swallowing or you have any difficulty with swallowing or you take longer time, do not ignore the symptoms. And most people know that they have trouble swallowing, stay away from the meats, stay away from harder texture foods, be kind to your body, listen to your body, eat softer foods, drink lots of fluids, chew a lot so it is, able to swallow. Because what you don't want is have a food bolus just get stuck in the esophagus. And that's when people get really panicked because they can't breathe, they have chest discomfort. And it's really scary, actually. And you have to come to the ER and you have to, get an emergent endoscopy. And we don't want that.
Now, can you explain more about that? I'm sorry to interrupt you. What is a food bolus, food impaction, and what's the difference between that and someone who's choking on their food when someone does the Heimlich?
Yeah. So the choking on the food is basically very similar. So when the food is stuck in any part of the esophagus, especially the upper part of the esophagus, it can cause respiratory distress. So because it's higher where the esophagus is and where your lungs and breathing system is also connected up here, you can have prevention of breathing as well. And that's where you have, the typical image everybody has, like people are panicking and gasping and for air, having difficulty breathing. And that's when you want to do Heimlich maneuver because the food piece is stuck right up here, compromising airway.
Thank
and
you.
The food, the second part is the food bolus. So this is the part that's important. So esophagus is a cylindrical tube. And if you had scar tissue and you eat and it sits here and you continue eating, it will just getting kind of piled up like a bolus, like a ball of food. And that's when people usually stop and they're like, okay, now the pressure is too much, because then they will try to drink lots of water. And you can imagine in a tube, if the food ball is sitting, well, the water is just going to kind of pile up and not go down. So that's another important thing I will say. If you have these symptoms, do not keep eating. If you feel like the food is not going down, please don't keep eating. Drink water, because that's the number one mistake people make. They're like, oh, it'll be fine, and they'll keep eating. So a lot of times when I go in and look and try to pass the food bolus, I see a huge stack of food. It's not just one bite. It's always everybody's like, oh, I just took one bite. It's not one bite. You can tell very easily because the esophagus is a pretty large organ. It takes a lot to kind of stack up. So listen again to the signs. And if you're feeling any kind of like, oh, it's not going down, stop eating.
And they would get to the emergency room, right? That's something for the ER.
Exactly.
You don't want to wait for that.
Yeah. If you're feeling that something is stuck, stop eating, come to the ER. If you feel like you can't swallow your spit, come to the ER. If you feel like you're choking or having any respiratory distress, of course, I hope there's somebody who can do a Heimlich maneuver that's standing next to you. Just call for help. But yes, stop eating at that point.
What about people that want to maybe self-induced throwing up?
Yes. People who do that and who are brave like that, they're the ones who have had to do that for a long time. And then they're used to it because they're the ones who have had adaptive behavior. So I have a lot of patients, they're like, oh, I just kind of put the finger in my mouth and induce vomiting. And, that is a little risky. Of course, in an emergent situation, you do what you got to do if you're not able to breathe and there's nobody to help. But it is risky to continuously doing that because remember, by inducing vomit, you're bringing all that acid up.
And things could get stuck. You could get other things stuck.
Exactly. And you could cause a big esophageal tear by inducing such strong retching. And we don't want that.
No,
Actually,
this is,
one of my other food impaction patients did that. And
oh,
when he came, there was a big esophageal tear with blood.
oh, this is such good advice. Thank you. And that's dangerous because that's such a delicate part of the digestive system.
Absolutely.
Wow. So is there anything else we need to know? This has been great insight.
The only last thing I would say is chronic acid reflux, so heartburn, which also means acid reflux. Please don't ignore it. If you're having especially nighttime reflux symptoms, do not ignore that, because that's when you have 6 to 7 hours minimum of exposure to the acid coming back into the esophagus. So if you're waking up in the morning with bitter taste in mouth, sore throat, hoarseness, all those are signs that you may be refluxing. And chronically untreated acid reflux or heartburn can lead to stricture and scar tissue in the esophagus that can lead to trouble swallowing in the future.
Oh, wow. This is great advice. Now, in terms of prevention, what do we need to know? How can we prevent some of the things you talked about, whether it's acid reflux or even, food getting stuck? How can we prevent that?
Yeah, that's good. Chewing well, not rushed eating. We live in a very fast-paced time right now where everybody's on the go. Just chew the food, take time, drink lots of water. Don't ignore any signs, whether it's reflux, whether you have family history, whether you have, all these adaptive behaviors that we talked about. Get treatment, get advice early, and don't ignore the symptoms.
Yeah, don't ignore the symptoms. Like, even though Dr. Singhal just gave us things to prevent it, that's not the solution. You still are going to have trouble swallowing until you get to a doctor to be properly diagnosed with either a condition like EOE or something else.
Yeah, and the great news is we have treatment. We absolutely have treatment options. So for most of the diseases we talked about, and great treatment options.
So there's treatments, and also, but you have to be honest with yourself so that you can be honest with your doctor. Don't hide, even if you may feel it's embarrassing. It's not embarrassing. You've seen it all, right, Dr. Singhal? You've seen it all.
Absolutely.
There's nothing to be embarrassed about. We want to get you to the proper diagnosis and the proper treatment as soon as possible so you aren't suffering. There's no need to suffer. This is 2023. There's no need to suffer. Well, this has been so interesting, and I can't wait to share this with our audience on YouTube and all of our podcasting platforms. We look forward to talking with you again. Hope you have a great rest of your weekend. Thank you so much for joining us.
Thank you, Jackie, as always. Appreciate it.
Oh, thank you. And don't forget to like, subscribe, share. We've been growing organically, but we still have a ways to go to get where we want to be. Spread the word. There's lots of great experts like Dr. Singhal who appear in our podcast episodes, and we'd really like to get this information out there. So thank you all again.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.